Dr. Stephan Achenbach. I'm Dr. Zhou, come from Capital Medical University, Beijing Anzhen Hospital. So I don't know your country situation about COVID-19 situation. So how to do this hospital for patient for PCI, emergency the PCI, this kind of the interventional cardiologist, the worker.
Yes. Well, the situation in Germany, as far as COVID-19 is concerned, is somewhere somewhere in the middle. You know that in Europe we had the first wave in March, April, and May of this year, and the second wave started about in October. But compared to other countries, the rates of infection and the rates of individuals in the hospital in Germany are much lower than in the other European countries. Still, it does affect our healthcare system. We currently have about 60 patients with COVID-19 in our hospital, 20 of them on the intensive care unit on respirators. But our hospital is in a relatively small city. This is why our numbers are not so high. But luckily, the German healthcare system is not overwhelmed. We can still take care of all the patients who need medical help. So our PCI, our structural heart, and our electrophysiology volume at the moment is not yet affected. We have to be very rational of using our resources even more rationally and moving the patients faster, even faster than we usually do, because we have lost some bed to generate COVID wards, but we can do everything that needs to be done. In the first wave, we saw that patients were staying at home rather than coming to the hospital because they were afraid that they might get infected when they come to the hospital. But now in the second wave, the population has become a lot more reasonable. The one thing that we do is when a patient comes in with an acute coronary syndrome and has even the slightest signs of respiratory infection, we cath in protective equipment, which of course is a little bit more cumbersome, but it's absolutely doable. So that's the only thing that really affects us a lot.
Thank you. So the two hospital belong to the cardiovascular disease hospital in the China, to volume number 1, number 2 volume in the cardiovascular disease the hospital, the Dr. Qian Jie our hospital. So in the early, the Wuhan hospital, the cardiologist to deal with about the PCI, the COVID-19 patient have a rich experience. We are often discussing this kind of PCI. And now in the Beijing hospital, we have a negative pressure transfer vehicle, the next negative pressure ward, negative pressure to transfer stretcher, to protect the patient and doctor in the non-infectious disease hospital. So now the Beijing have no COVID-19 the patients. So we are maybe we wait for next wave the COVID-19 pandemic, this second or third wave. But some of the patients to transfer from the North America and Europe to come back to China. So and Beijing are very safety. So what about the Dr. Qian Jie? So like the hospital, we have two negative pressure the cath lab for to give this the positive the very positive patient to use. But now we haven't a chance to deal with this kind of patient. Well, what about Dr. Qian Jie?
Actually, in Fuwai Hospital, we don't rebuild this kind of the facility. maybe because we are not different with Anzhen Hospital still. So we are just the cardiac center. So we have the, if we have checked the patient have some probably positive some, usually we do the fibrinosis inside of the primary PCI, and then maybe according to our hospital protocol, we'll transfer the patient to the maybe to your hospital.
Yeah.
But actually, I heard the Stephen said the news. German have a good control. I heard from the news, and how can German colleagues can the experience control the COVID-19 pandemic in Germany and not overwhelmed use the medical resources and keep the medical staff relatively safe, and can also your side can keep the volume of the routine work as usual?
Well, there are three reasons for this. There are three reasons why we think Germany is doing relatively well in the COVID-19 pandemic. Number one, we have a very effective public health system. So we have in every city, we have public health offices, and they trace all the positive patients, and they trace their contacts, and they tell them to stay at home and in quarantine. And so this is very effective, not very effective, but more effective than in other countries to keep the infection chain under control. Number two is, of course, our population in Germany is relatively disciplined. That's just, you know, nations are different. And in Germany, individuals usually are relatively disciplined and they follow the orders. And our politicians relatively early introduced measures, even though the measures were not very strict, they were introduced early, like wearing masks in public, which is not a usual thing in Europe to do. So that was helpful. And then thirdly, we are lucky because we have a lot of hospital capacity. Germany is often criticized because we have about 3 times more intensive care beds and about 3 times more normal beds in hospitals than other countries have per population. But now, of course, this is a big advantage.
Yes, we are learning about the Germany. The public health is very, very good, and to discipline. We learn to Germany discipline the spirit. I think the high spirit.
But the public health
is a very,
work
very
well.
strong basic for the prevent COVID-19 is a pandemic.
What does not work so well is the Germans don't like the app, right? We have an app where we can trace and find contacts, but the Germans are very reluctant about using the app, data protection and that kind of thing. So that's why this does not work so well in Germany, but the public health offices are very effective.
The young Dr. Gao, what about your discuss?
Professor just mentioned that apps or smartphones is relatively less be used in Germany, but on the other hand, in our country, the electrical devices make great contribution in the control of the COVID-19. In our hospital, we have some apps for the patient as well as for the doctors. Each doctor have to report their health condition, and if they have traveled to the high-risk area, they have to report their footprint through the smartphone to the authorities. And all the patients, before they come to the hospital, they have to use the smartphone to trace their footprint, trace their if they have been to some high-risk area. So I think the smart devices in a large extent to help us to control and to discipline the patient as well as the doctors to keep them safe.
Yes, I would think that's certainly good. The German government tried to introduce it, The apps are available, but the population is reluctant to use it.
Stephen, may I ask you one question? So how to, even in Germany, how to deal with some cardiac shock or some very severe patient? And it's tough. I mean, you need lots of medical staff and lots of respiratory and intubation, lots of things. And how to, if the patient have the COVID-19 infection, let's suppose this patient, cardiac shock patient.
Luckily, we have all of this available. We have patients on respirators. We have in our hospital, we can generate about 130 respirator beds. The hospital has 1,300 beds, and we can turn 10% of them into intensive care unit beds with respirators. We also have ECMO available. We've also taken some patients from other hospitals on ECMO so that we can try to stabilize them. But of course, the mortality rate is not low in patients who are so severe diseased. Currently, our infrastructure allows to take care of this, and this is what our politicians try to do, to keep with the public measures the infection rates not by zero, doesn't work, but to keep them so low that our hospital system will never be overwhelmed. That's the strategy. And of course, we're all hoping for the vaccination. And it looks like in mid-December, the first vaccinations will start here in Germany. That's the prospect.
Just Dr. Gao said to the Chinese the health certification for this my certificate for the green to Shanghai.
Green is good.
It's good to every place to use this. To green for your health. So what about the due to impact of the COVID-19? Many medical conferences have been held online. Now we attend about over 100 to medical meeting. So what's about so Germany, your hospital to meeting, maybe to change online, maybe what about think the future to the medical discuss and to meeting, maybe online about 50% conference.
Yeah, this is a very interesting topic. And of course, in Germany, all meetings, all medical meetings and other meetings have been turned online. Our hospital doesn't allow any meetings. Our professional societies don't do any meetings anymore. It's all online because the physicians are not even allowed to travel. You have to stay in your hospital and work. I am in a specifically difficult position because I'm the president of the European Society of Cardiology. And the European Society of Cardiology has very big meetings. Our largest meeting is the ESC Congress, which typically has about 30,000 participants. This year, we canceled the on-site meeting and turned it into an online event. And we had 120,000 participants. So 4 times more than we usually have. And we could reach countries that typically don't come to our Congress. We reached Colombia, Venezuela, all kinds of countries with our online Congress. And you said it already, Dr. Zhou, that this is the model of the future. In the future, I'm convinced after a transition phase, individuals have become so used to using the online infrastructure now that congresses will have 2 branches. There will be an on-site component where people meet because people want to meet, people want to travel, people want to see and experience and hear and smell and touch the Congress. But at the same time, the congresses will be designed in a way that they can easily be also transmitted into the internet. This does not work with a conventional format, 90-minute sessions, 50-minute break, another 90-minute session. This will become faster, more adaptive, and we will have 2 components, online and on-site. And in some respects, online is even better.
Yeah.
Visuals are always perfect. You can always see the slide. You can have a cup of coffee. You can switch it on off for a while, go for a walk, come back. it's in many respects, it's, you can see the slides perfectly. You know, sometimes in a big lecture room, you have to see, but so the on-site will more cultivate the experience, you know, fun for the participants, excitement. That will be the on-site that needs to be cultivated, not nonsense, reasonable things, interaction, you know, things that you remember because that you were there. And the online will be very educational. I'm convinced of this.
So I think so. So COVID-19 maybe change the world, change the lifestyle. So in the China,
yes,
so
it has certainly accelerated change. It certainly accelerated the change. I'm convinced.
Yeah. Yes, the change everyone life. So every weekend we fly to the different province, hospital, different the police in China to attend the local medical meeting and the China summer conference. So very busy. But now about the 10 months. We are to have a little chance to attend to this meeting or congress. So only the online to maybe to save the much time and to we can do something sometime I have no time to do something. So now we are to a virtual room in my family and my office to discuss something online to same time to continue to the two meeting. We can to same time to attend. This is very interesting.
Yeah, I also totally agree.
Yeah, as you see, you know, sometimes you give talks in 4 different countries on the same day now because you can just hook on online and talk to lots of people.
So maybe as a 5G as a internet to technique in the China some hospital, especially the to some doctor to guide some local hospital use 5G technical internet to guide some operation, some the local doctor to operate the patient in the China. Now we are wanted to use interventional cardiologist to for some TARI for newer technique in the cardiologist the field.
Yeah, we have done the first robotic PCIs in Germany in some centers. Gießen, for example, that's a good friend of mine, and it works rather well. So we can imagine that remote operations will become much more feasible than they have in the past. I personally, you know, like to do it right there with my own hands with the patient, but it's not about personal preference. It's about what is best for the patient and for the system.
Dr. Qian? Yeah, I totally agree with your discussion. And actually, if I mean in China, sometime recently somebody invited me to attend some meeting doing, but only if they need to do some procedure, and otherwise I really reluctant to fly anymore, and I want to stay in the I will always choose online. And actually I attend 2 or 3 meetings in recent, but still when I read there, but it's a big room and only 1, 2, 3 monitor and and 3 working staff. But I
workshop online.
yeah. Why?
Well, I think a few years back, if there was online, it didn't work very well. Yeah. The image was poor, the sound would cut off, You didn't see very well. Now we all have, good lighting, nice cameras, and we all have good microphones. And the technique has become much better. Not a revolution, but an evolution. So this is how things have become much better. So this makes online much more accessible. We're all fully equipped now to deliver high quality online and receive high quality online education.
Yes, Stephen, and ask you one question. You are the chairman of ESC. So I mean, how do you design the next year ESC? Yeah. I think you have some plan. Still online or
fantastic.
Both?
Yeah, we're currently working on it. We are designing ESC 21 as an online event. So the entire format will be different than an on-site event. We have shorter sessions. We will pre-record a lot of sessions. We will have interaction through the internet. We have live sessions that are transmitted from several places in the same time. So we are designing an online Congress. Maybe we will add an on-site component to it if the developments continue with the vaccination and everything. But the primary event we are planning, the entire program is planned to be delivered online. We're currently having all the meetings. We have a group of about 70 doctors who plan the program. That's the system that we have in the European Society of Cardiology. And the meetings are just now going on. It's usually the month of December when we plan all the sessions. So this is what's happening right now, but the entire structure has been changed so that it's optimal for online delivery.
So let me go and ask another question. If online, so you think the ESC, the conference, the lecture, the live demo, everything experience can be more longer or more topics can be available, because you have a channel 1, channel 2, channel 3. You can actually, if not so expensive, you can afford maybe so many different channels, like different room, but the room still is limited.
So about the 1 week ESC Congress. Yeah.
No, the duration will not be longer because our doctors, they have to go back and work in the hospitals. The duration will not be longer, but the content will be available longer, of course. The content will be available forever. The sessions, will there be more sessions or less? We are worried that if we add a lot more, it's cheap, but it would overwhelm the participants. It's like when you go to a store and there's one jeans you can buy. You buy it and you're happy, right? If in the store there are 10 pairs of jeans, first you think a long time, then you buy one and then you're unhappy because you think the other jeans would have been better. So more choice, that's also a psychological knowledge, does not always translate into more happiness. So we have to find a good balance there, and we will not be adding a lot more sessions than we have usually at the on-site meeting. However, times, we will adapt. We will have sessions that are in the middle of the night in Europe so that they can be consumed during daytime live in other parts of the world. So in that way, we will certainly expand.
So we hope to attend the ESC Congress, so to share about Europe, the culture and the education, and to the top level the experience. So maybe next year, so the COVID-19 maybe.
We will welcome you at some point at ESC Congress, and I very much look forward to that.
Yes. Dr. Gao, what about you to discuss?
Well, I just wonder that maybe even I just ask all the professors, do you think if in the near future, when the pandemic is over, the on-site meeting will be disappeared and the online meeting will replace it, or it will still, on-site meeting is still our top priority? So how do you think?
Who wants to go first? If I'm going first, On-site meetings will remain. At least the large ones will remain, because humans want to get together. It's in our genes. We want to meet, we want to exchange, we want to have fun together, and we want to think together. And there's something about meeting each other that you cannot replace. It's even smell. You know, we all know that there are olfactory signals that we don't really smell, just scent. It makes us feel comfortable to be in a community. And this is what people want. And this is why these meetings will not go away. They will change. They might become smaller, but I'm convinced they will not go away.
So
maybe I'm completely wrong. We'll see. Maybe I'm a dinosaur and will be extinct. But I think I'm pretty convinced that this will continue.
So we human being maybe to never to become to rabbit or robot and machine. So I think we conquer this COVID-19. In China have a belief this should be conquer this kind of a virus. So the different vaccine useful in the world. I think to America, in China, too many the vaccine to want to use in the weekend. I think maybe after three months, about 20% or 30% patient maybe to vaccination to finish, maybe to pretend this wall in the to everyone to prevent the virus to pandemic, this kind of things. I think maybe next year or to maybe ESC maybe to have had hold some the country. What about next year or 2 years to which country to want to hold this ESC?
We're still negotiating about the destinations for 22. Because we had some cancellations, so now we have to see where we are. So it's not quite decided yet.
Yeah.
But I'm sure it will be a very attractive destination in Europe.
Yeah. So the Dr. Qian Hospital, the Beijing Fuwai Hospital, our hospital, Dr. Gao and to our colleague in the Beijing Anzhen Hospital, for the PCI every year about 20,000 kids 1 year. So for 30,000 kids 1 year for coronary angiography. So it's volume number 1, number 2 in the China. So our two interventional doctor like the machine to the cath lab every day in the weekend to worker to we think to this time you give have a very good chance opportunity to discuss this kind of the different situation, different the method to deal with COVID-19 in different hospital. So give this experience for the Germany, this social, the culture, the public health. So social discipline is very useful in the prevent the COVID-19. We think in the China we use public this the government to control this very strong to fastly to control this very worst situation in the Wuhan city. So now the China is to only some city have the few people the COVID-19. So this change the environment, the situation in China. I think in the Europe maybe a vaccine to change the next to step to change the Europe situation. We wait American
getting ready
to change. So
yes, I mean we're getting ready to get vaccinated in Europe, but as you said, it will take a long time to even get 20% of the population vaccinated.
Yeah.
It's a logistic challenge.
So this the international circulation, this the China the very famous to online this organizer to organize to this discussion. So we are to translate this discuss with your very famous Dr. Stephan. So President, yes,
you're very kind.
We are very honorable to discuss about it. So we think we have we have many to opportunity to discuss in the future. So we are to
yes, I hope.
wanted to some information give Chinese the online to doctor some several generation doctor to know we are discuss to know ESC now in the future the ES Congress maybe this year so online to organize this ESC Congress. So the Chinese about to over 10,000 the doctor the Congress to change online this year. Next year maybe to change come back to the some we change the different Chinese police to hold this bigger the medical congress, especially to cardiology field. Dr. Jie.
Yeah,
so
these are very
the last
important.
yeah, you give us some President Stephan some information.
About our conference.
Yeah.
I think it depends. It depends the still COVID-19 next year and pandemic. If still not very safe in the world, and maybe the very big conference maybe not allowed. I guess maybe our hope is the year after next year is our maybe more practical. But I still agree Stephen's side. We are human, so even now we like some colleagues, friends together to drink and to talk and to say something and have a dinner. So I agree. On-site conference still very attractive in the future. Maybe, but the change allowed some online because some conference is also cheap and can very efficient. But some bigger one and very famous one and still maybe will be held on site, I think, in the future.
So it's time to say goodbye for President Stephan. So at last, we hope to say something for Chinese doctor online.
Yes. Well, I would like to wish you all the very best as this difficult year is coming to an end. We see that China has done a fantastic job facing the challenge very early. The other countries could learn from you, so we are grateful for that. And let's all hope that the next years and many years after that will become better and better and better, because we must not forget that cardiovascular disease is even much more dangerous than COVID-19. and it will be with us for a long time, and we have to fight together to reduce the burden of cardiovascular disease. So thank you very much.
So thank you very much. So maybe I think you are lunchtime with discuss with us. So thank you very much. We are hope to next year to come to Beijing and to our country. So welcome President Stephan. Welcome. Thank you.
Thank you very
Bye-bye.
much. It was a pleasure.
Bye-bye. Thank you very much. Yeah.